Many patients have been left reeling under the impact of the situation, leading to financial hardship for countless families. Some have been forced to pay as much as 3 times the usual cost for basic medical care. This has thrown many into despair.
They said it was down, system was down, so they couldn't access it, they couldn't use it. So even for those that wanted to use it to process their card, they couldn't, they have to pay physical cash what they can do.
So, like, the problem with the whole NHIS system is, you see, we find ourselves in a system where the government kind of like works with the idea that the citizens shouldn't worry. You will provide everything for them. So it's like you have rented a place and you sort of like depend on your landlord to take care of your children, to pay for their school fees, to pay for their hospital bills. It's like you pay a certain amount of money to the landlord, maybe monthly or something, in the form of a tax. So it's like it's the landlord's duty to take care of your children and pay for their school fees and their hospital bills. It's the same. The government is, in a way, trying to see that he's not going to give us money, but he's going to take care of your children, their school fees. He's going to take care of your hospital bills. So you don't need money. It's like you don't need it because he has it. He has covered it for you. So what this means is that the government doesn't really put a lot of effort into measures that can put money in your pocket, but he put a lot of effort into measures that will sort of like solve your problems for you. He's taking away your agency of solving your own problems. The government is behaving like your father in this scenario. So you can see that it's only your father who pays for your hospital bills and your school fees. But you can see that these days the government is paying for people's school fees. And then he's paying for people's hospital bills. Initially, when the whole NHIS system was introduced, it was nice. It started out nice. I didn't learn a lot about politics back then. But then after some few discoveries and knowledge acquisition, I have come to realize that sometimes most of the social government initiatives, but you see, in this sense, it shocked me a little bit because I found out that the person who initiated this NHIS program was not a person from the social government, but it was a conservative, like from the Conservative Party, the NPP. I think Kofo started the whole thing. It shocked me because they are not supposed to do that. They are not supposed to do that. They are not supposed to give people free SHS. They are supposed to provide opportunities for people to work hard, make money, solve their own problems. So we don't need an NHIS system which can shut down at any time. That will put you in trouble because now you don't have money and now the system that you rely so much on doesn't work anymore. It doesn't put you in a good position. So rather than depending on something that can fail you any day, why don't you depend on yourself? So you know yourself, you know the days that you fail yourself, and you know that since you are the only person that you have to put a lot of effort into putting yourself first so you will succeed. So if you have the opportunities to make money for yourself, you can make money for yourself. If you want to pay for a child's school fees, you can pay for that. If you want to take yourself to the hospital, you can do that on your own. You don't have to rely on someone else. It doesn't even matter if somebody is giving out free things because you have your own things. So we find ourselves in this situation. Eventually, when the NHIS started, it was working, it was nice. I think the person who did it for votes, politics. So everything was going well. I think after a while, I realized that this system will crash eventually because I realized that, it's not right for the government to interfere into people's personal matters like that. And then the government will be taking people's medical records and, it's a lot. So I think this is what we are witnessing right now, the collapse of the whole NHIS system. Because now it's not working. And now people are complaining that they don't have money to pay for hospital bills. And since the system has been working and we have sort of like structured our whole medical association and system and whatever around it, without it, I think people are suffering the consequences like threefold. People are paying medical bills 3 times the usual. So let's continue. You will see if
do it for them. So they didn't really say anything. They just told us the system is down and it's everywhere for about 2 weeks.
In response to the crisis, some healthcare facilities have begun implementing manual claims verification procedures to minimize disruptions. At the Greater Accra Regional Hospital, the situation was no different as patients had no option but to pay more for treatment and medication.
What's insurance? Because what's a hospital you are buying there? In the can you consider costs are buying so fakakra. So I buy on consideration now.
and the other to see, I quite say, yes, but you are buying some fakao. And that is the position that we find ourselves. It's like Yankasa, we have made up our minds, say, a bit depending on the government for everything. So now we are suffering the consequences of it. So now even the government doesn't realize it's like the citizen has become like children. Into one knows what show Bama. Feed you see, like, but the government doesn't do that. It's like the government is providing services, and these services in turn provide opportunities for the people who subscribe to the services. So if it is educational, the government is providing with education services. If you are able to go to school, you pass how you graduate that, you create an opportunity for yourself in the field that you studied. So you can further your career, maybe probably get a job, and you are set for life. And definitely, if the government like initiates a system or an organization, anything else, maybe a factory or something like that, still providing opportunities for the people. But now the government isn't doing that anymore. Instead, the government is spending more time paying for people's hospital bills, and I don't know. So let's continue.
I bought medicine at the hospital. According to them, the system is not working, so they can't get me a receipt.
Then this is really affecting you.
Of course, because I use my own money, so I have to let the office know. Then they quickly get my money back. But in this case, it's free.
I am more fast and now. You didn't buy and will be 10 days. I will clinic. I buy about insurance and year. According to doctors, what's system as a problem be a bounty into me and find insurance.
However, officials have yet to comment on the situation or provide a timeline for restoring the system, leaving patients and healthcare providers anxiously waiting for relief. For Joy News, Fatal Bayaga, Accra.
Well, in Kumasi, relatives and care.
So you can see that still people are still clinging to the old system, the old ways. Like they still want the system to come back up. They are not seeing that the system is the problem. They still see the problem to be the solution. We have been doing this for a very long time, and it has brought us to this place. I don't think doing the same thing, we should expect different results. We should expect the same result. Still, we'll go back. If we do the same thing, we'll be going back. I mean, maybe it's time the government should maybe provide opportunities for its people and maybe stop trying to interfere with our personal matters and our personal affairs. Like that, maybe you should give us the power to maybe live our own life. They lie to us that we have the power and democracy and all that stuff. But you can see how they can sort of like navigate elections. If the person comes to you and then you vote for the person, not by your own judgment, but by maybe an external factor, an external influence, then you are not making your own decision. Somebody is making it for you. So, I mean, maybe it's time we sort of like, maybe they start trusting us to maybe make our own decisions. I don't know why they treat us like children, though. So, I want to see what this person will say after this whole segment.
Cases of inpatients at the Konfanoche Teaching Hospital say they continue to bear the medical expenses of their hospitalized family members despite processing or possessing insurance cards. Although these cards are requested at the Konfanoche Hospital, patients and their relatives are skeptical and anxious their medical bills could escalate.
What's painful is that anytime a drug costs just 5 cedis, they still ask you to go and buy it.
Work hospital and I am charging you do 5 cedis and I want to sell Kwakuaka. A day. Like if Sabaya promises say over 2 years and money, but unfortunately we're disappointed with your yoga. Into who say, you know, who yanti as you say, any panda will disappoint you on an outcome of reality. Into now one dungeon won't say a band will be disappointed with Dana. You know yourself, you know what you need, you know what you can do for yourself. Into who town or more be my child say, oh, you say, and I say, and I say. Say, Nippon so I promise also be boa. Instead of so be ye nam namon, man and cho send ye see and am lose. Now one cassa we had the well you are there. Omukasa and they say this all the time. And until I am a makas and kufu, they are talking and then their action are 2 different things. Your own can the way of behaving. They are 2 different things. So we do Omukasa here. I'm sure I'll be making decisions. I'll be no. Right now, me sure say in the Pacono initiate NHIS program we say, or yeah for photo. Time or the buy them. One mammy church won't be for you. Because we'll be a muso question here. And one is all the buyer, Yadiaba. I didn't even fit as the end of the air there. But ye come power won't say we know a boy for. Indeed, would ye what the buy and all? May sure saw the buy Bible boy power because when him say at the end of the day, what? It's definitely when him said in conclusion, what? By an infitias and there into the other neighbor, not infitias and a barbeji food. Yet too many winners or qua says, say, what? Like this is how these people they think. It's like they are always betting everything on the immediate solution because immediate solution fixes their problem. And if they are really thinking about in a future, and we will see, but they are not. And maybe it's time we start thinking about our future. Let's continue.
Yourself. It makes the insurance feel useless. Is the insurance not working? They should be honest with us and let us know because we've been spending too much money buying medicines.
It's been a month since I came here, and the insurance hasn't covered anything. I've been paying for medicines every day, yet they don't work when you buy one.
When you come, they don't take the insurance in. They give you another card. After that, you have to buy your own medicine, even your own bed sheet.
Because who needs cardia? I just said,
because you see, one more opportunity where me when I'm one yes guy. And I catch us, oh dear massa, oh dear, no baby, I may am. After I do the point, and open on your mouth you. Into won't have you. It's you mere to us. I bet I'm chance in your
Edro ya try edro ya ne ya koto edro no 7,000 2,000 ya dro ya try off from me fancy off from cry 1,006.
The insurance isn't working. We buy all the medicines ourselves, sometimes spending 7,000 cedis, 2,000 cedis, or at least 1,600 cedis. We don't even know what the insurance actually covers. Maybe just the bed.
Insurance no e cover dia e no di minimum ho ase.
Madia kan dia moto.
Bibia ye to.
You've seen everything. We were in the past and now we are witnessing the future. Maybe it's about time you stop complaining. I know if you stop complaining, the government will see that maybe we are not complaining more, we want action. So instead of the government giving us like verbal solutions, like promising us solutions that wouldn't last, that doesn't have a future. Instead, maybe they can listen to our side of the story. Omonji and see nyansa kakra na ye wono. No mo so fan compare omo de ne hwe nye beboa. Entimi command say that bia omo no betena ba bi no make decision am aye na then all the time na ye brain no omo no koso. It doesn't make sense. So this is the end of the video.